Hello and welcome to an exclusive interview brought to you by Elite Business Chronicles. Today, we have with us Mr. Mark Fox, owner of the company Resona Health. He also created the device Vibe, which uses magnetic pulses to support growth and also reduce pain. So, let's start. So, Mark, please share with us your journey that led you to the holistic healthcare space and to your current role at Resona Health.
Yeah, I mean, I never planned to get into any kind of the health space. I came from rocket science and aerospace, and it was this thing right here. Couldn't come up the stairs one day, my dog, and so we took her to the veterinarian. She had severe arthritis in her spine, unfortunately, and so it's like a very good friend of mine who's another veterinarian. I called him and talked to him about it, and he said, "Hey, there's this special machine that uses energy and frequency that can reverse arthritis." So I'm like, okay. So I got really interested in that. I really didn't believe it, but it's my dog, so we're gonna try and make something happen. And she ended up getting sick too fast, but I ended up learning about that technology, and it was frustrating because it was being held hostage with expensive machines in a clinical environment. And my logic was, there's got to be a way to make one that's just small and affordable and portable. So that's how I got started. The mission was just diving into trying to make one that's small, that's affordable, can be built affordably, and is at a price point people can afford. So it took a couple years to do that, but that's how I went down that path.
Oh, that's a wholesome story. So, tell us more about PEMF, that is pulsed electromagnetic therapy, and how exactly is Vibe helping your target audience?
So PEMF, it's a fancy word, pulse electromagnetic fields. It's not anything voodoo or weird because it's the Earth's heartbeat. The Earth's putting out PEMF all the time. But if you think about it at a higher level, is nothing in the world happens without an energy exchange. So you don't eat food, you don't drive a car, you don't walk, you don't breathe air, you don't cook s'mores on a campfire. Everything is an energy exchange. So energy can be transferred to your body multiple ways. It can be light, sound, vibration, electrical current, or magnetic field, PEMF. So I just chose PEMF because it's the most convenient method instead of putting wires on you. And you don't have to be sitting in one place. So it's therapy on the go. It can just be in your pocket. The way it works that we understand in this environment is it's more complicated than this, but this is what we do know. The cells in your body have an electrical charge on them. When the charge gets too low, you get sick. So it recharges your cells' batteries. It increases the voltage on the actual cells. And then it increases ATP, which is the number one fuel that your cells use for food, and it increases ATP up to 500%. So those two main things, it's recharging your cells' batteries, it's providing a much larger food supply for the cells so your body can do what it does best, which is heal itself.
Okay. Also, can you discuss a significant challenge you faced while bringing Vibe to the market and how did you overcome it?
Yeah, lots of things. It's a balance, right? You're like, I want it to be light enough to put around your neck. I want it to have a long enough battery. People don't complain. So like 5 hours. You can't put out too much energy because it gets warm. And that's why it has vent holes in it to help cool it. Getting the coils in there. So what it actually is, it's actually a music player. It just doesn't have a speaker. It has coils and they're actually MP3s. The files are all songs and you're running the MP3s through the coils. So get the coils, mama bear, papa bear, baby bear, to get that just right as far as the number of wraps, how big is the diameter of the wire, does it therapeutically work? It can't get too hot, it can't weigh too much. So it's finding the Goldilocks point of all that stuff is how to make it all work was a challenge, especially the coils. We probably went through hundreds of designs to try to get it to do what it needs to do.
So, it was a tough task indeed. How do you foster innovation and adaptability within your team?
Um, Well, I don't have to. They're all pretty innovative, and they keep they bring in too many products to the table and too many ideas. We actually have to kind of do the opposite to filter them a little bit. But Um, as far as the leadership thing, as I tell everyone on the team, act as though it's your company. Quit asking me about, hey, this customer and do they refund here or they want a special deal. I said, just do it. You don't need to check with me. I might yell at you, but if I do, deal with it. It's just, I don't have time for that. I want you to, most people are reluctant off 1,000 times. So I need somebody at Philips to call me back to figure out how to get around their bridge on the lights. The other dream that I have, and I put out a $25,000 contest and nobody did it, was on your phone. They have a cheat coil in there that you used to charge your battery. Use that coil to send the signal out. So find a way to hack the phone OS so that I can turn every phone into a therapy device with an app. And everyone's telling me it's not designed that way. I know it's not designed that way. Figure out how to hack it. So I offered $25,000 and nobody has come up with it yet, but somebody will. Somebody will find a way to hack the actual phone so you wouldn't even need my device. I put myself out of business and we just sell an app with your cell phone because the cell phone already has the coil. It's just designed to put energy in. It isn't designed to have energy come out of the coil, but it's got to be possible somewhere in the OS to be able to do that.
Hopefully, you achieve that goal sooner. And it was an honor talking to you. We end our interview with all this. And thank you so much for your time and presence. This brings us to an end. I wish you all the best for your future. Thanks for being here with us today.